What are the different types of CPAP titration methods? If you are curious about how doctors determine the best air pressure settings for continuous positive airway pressure machines, you are in the right place. Let's break down the different types of CPAP titration methods used to treat obstructive sleep apnea. First up is the in-lab full-night CPAP titration study. This method is often seen as the gold standard. During this overnight study, a sleep technologist monitors the patient in a medical facility. The air pressure from the CPAP machine is adjusted throughout the night. This is done to find the pressure that effectively eliminates apneas, hypopneas, and snoring. The patient wears a CPAP mask, and the technologist ensures it fits comfortably. Adjustments are made based on the patient's breathing patterns and sleep stages. Next, we have the split-night CPAP titration study. This method combines diagnosis and titration into one night. The first half of the night is used to diagnose the severity of sleep apnea. If significant apnea is detected, the second half is used to adjust the CPAP pressures. This approach is efficient but may not provide as much data for both diagnosis and titration. It is usually reserved for patients with severe sleep apnea detected early in the study. Then, there is at-home CPAP titration using automatic positive airway pressure devices. These devices automatically adjust the air pressure throughout the night. This method allows patients to undergo titration in the comfort of their own homes. It is especially recommended for those with uncomplicated obstructive sleep apnea. Research shows that at-home titration can be just as effective as in-lab methods for these patients. Lastly, we have bilevel positive airway pressure titration. This method is for patients who need different pressures for inhalation and exhalation. Bilevel positive airway pressure devices are used during a titration study. Both the inspiratory positive airway pressure and expiratory positive airway pressure are adjusted to optimize breathing comfort. This manual titration typically occurs in a lab setting during polysomnography. When considering these methods, proper mask fitting and patient comfort are essential. The choice of titration method depends on the severity of sleep apnea and patient preferences. Split-night studies are efficient but best for patients with clear severe apnea. At-home titration offers flexibility for uncomplicated cases, while in-lab titration remains the standard for detailed assessments. In summary, the main types of CPAP titration methods include in-lab full-night studies, split-night studies, at-home automatic positive airway pressure titration, and bilevel positive airway pressure titration. Each method is tailored to meet patient needs and ensure effective treatment for sleep apnea.